And we'll call the Health and Human Services meeting to order. Roll call, please.
The member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson?
Here.
Commissioner Killeen?
Here.
Chair Baker McCormick?
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
No remarks. Next item.
C, approval of the May 11th, 2021 meeting minutes.
Do I have a motion for approval?
Move approval, Anderson.
Support, Marecki. It's been moved and supported. Is there any discussion? There's no discussion. Roll call vote.
Commissioner Marecki?
Yes.
Commissioner Dobb?
Yes.
Commissioner Anderson?
Yes.
Commissioner Killeen?
Aye.
Chair Baker McCormick?
Yes. Motion pass. Next item, please.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, an update from Dr. Mahana Hamami regarding COVID-19.
Dr. Hamami, welcome.
Thank you, Madam Chair. Good afternoon. Mohanad Hamami, Chief Health Strategist. And if I may, I would like to share with you a very short presentation on our updates for COVID-19. I hope you can see my screen.
Yes, we can. Thank you.
Wonderful. Okay, so the good news is we are on the decline for all our cases. In fact, we have seen a 30% decrease from last week. Our total new cases for this period, and we're talking about May 16 to the 22nd, is 762. This is the first week or 7-day period where we dropped below 1,000, and that is since February 21st, so which is great news. And the same is applicable to both our new cases as well as our death count. Our testing remains still relatively continuing. We are seeing more tests, but not as much as we saw during the beginning. This is a very beautiful graph. As you can see, this is our 14-day cases, and again, that both the linear as well as the cases are dropping, which is exactly where we want them to be. This is when we started back in March of 2020 up till now, and within a year and almost 2-3 months, we have seen the ups and downs. But again, as you can see here, we are going down to probably similar to where we were in July of last year, which is again very good. Our positivity rate is also going in the right direction. In fact, this current period, we are at lower than the state of Michigan. We've been always higher relatively. And as you can see, 2 periods ago, we were at 9.5, then dropped to 7, and now we're at 5.1, while the state is at 5.4. Again, these are the numbers that we would like to see. We were at some point in June and July of last year, we were in the 3 to 4%, and this is exactly where we should be. Nothing has changed in terms of our top 10 communities, although all the total or absolute number of cases are dropping. However, percentage-wise, we are still seeing the usual top 10, Dearborn Heights, and Taylor are high up, Westland at 7%, Redford and Canton at 5%, Hamtramck, Belleville, and Livonia at 4%, and Inkster and Lincoln Park at 3%. These are the percentage of cases of Wayne County. Our variant also have seen a slight uptake. So again, the majority are the B117, which is the UK variant. The good news is that if you recall, 2 weeks ago, I reported that we had only 3 of the B1617.2 India variant, we only gained one extra case, which is good and encouraging. Again, we expect those variants to increase, but we are seeing also a slower slope in how they decrease. We didn't get any new school-related outbreaks. These are all ongoing cases. That means they happened before this reporting period. And again, as you can see, they are relatively distributed in different communities and mostly between elementary, high school, and middle. So there isn't a common theme here. And we are starting to see, again, where we were mostly seeing students, we are seeing some transmission in staff as well. Our vaccine numbers are, again, going in the right direction. As of May 22nd, we have received about 300 doses, and we have administered 170,000 and 300,000 doses. We have administered 170,000 and redistributed 76,000. So in total, we are probably at 85% of using the vaccine supply that we received between administering and redistribution. We are, however, as I probably reported last meeting, we are seeing a slower and lower volumes of our standard vaccine sites. However, we started working with the schools, and specifically after the authorization of the Pfizer vaccine for 12 and over. So we have held several school clinics, and we have done Redford. Last week, we have done Plymouth Canton Community Schools, where we had about 420 doses administered, with the majority were in students. We did on May 20th, Summit Academy at Romulus, where we had 112 doses. And just last Saturday, on the 22nd, we were at Northville High School, where we had 560 doses administered. So this is great, because these are the numbers that we would like to see. And of course, we are now tapping into the population that is the younger age bracket, which we certainly want to focus on. This is the numbers from the Michigan Department of Health and Human Services. So the bottom line is that we have now more than 500,000 county residents, and this is out Wayne County data. We have more than 500,000 people that received at least one dose, and that is about 58.6%, almost 59% of all those that are eligible in Wayne County. Those that are fully vaccinated, of course, the percentage is less, because there is that 3 to 4 weeks delay. But if we look at the age groups, the highest we have are in our senior population between 65 and 70-year-old that received at least one dose, and that is about 84%, followed by 75 and older, and then followed by 50 to 64. So these numbers are very good and very encouraging. And even if we start looking at the younger, where we have crossed the threshold of 50%. Of course, our focus now is in the population between 16 to 29 years old, and we just started logging the data for the 12 to 15. I did show you these heat maps. Again, we get those from the Michigan Lighthouse. The Michigan Lighthouse does not provide 12 and over yet, so they limit their data to 16 and over. And as you can see, these are anybody 16 and over in Wayne County that received at least one dose. And the green color is that is over 50% or 60%. And as you can see, our county is now starting to be more green than those areas where they're pink shaded. And this is what we would like to see. Of course, there are still pockets where the percentages are below 50%, 30 to 40, and in some very small pockets, we're looking at 20 to 29. Lastly,
I'm
yeah,
sorry, excuse
sorry,
me.
yes.
I don't see your screen any longer.
Okay. Let me try to
I
reshare.
do. Oh, I was still
See it?
seeing.
Okay.
Oh, you do see it?
I was when you had
Okay.
it up there.
No,
but-
it's gone.
Can you see it again?
Okay,
Yes.
now I can see it again.
Okay.
Okay, thank
Yeah.
you.
So that's the heat map, and I have one last slide, and I think this is a good data to show and boast about. These are the vaccine coverage as of yesterday in Region 2 South and North, And as you can see, Wayne County is ranking number 3 in terms of anybody that got a dose. We're only third beyond Washtenaw and Oakland County, and we are even at a higher rate than the state of Michigan. And I'll be more than happy to answer any of your questions.
Thank you. I just had one question, and then we will go to Commissioner Dobb. There is reports of heart complications in young teens. Have you or have Wayne County had any of these incidents, or is it anything you have any knowledge of?
No, we haven't. We haven't seen any serious side effects beyond what we expect, and especially in the younger population. I think most of what we are seeing is the nervousness and excitement about getting vaccinated. But in terms of any serious complications, we are not encountering any of those.
Thank you. Commissioner Dobb?
Thank you, Madam Chair. With the lighthouse mapping, that map, can the commissioners get a copy of that?
Absolutely.
Okay, great. And then I do want to thank you for going out to the schools for those vaccinations. Although I'm a little, I mean, looking at the numbers for my community, at least we had 418 for Plymouth Canton Community Schools, which is great, but we have over 6,000 students at the Plymouth Canton Educational Park, which is our high school complex. I'm hoping that most of the students went, on their own time and got vaccinated at the clinics or at a pharmacy or their doctor's office. But, when you look at the number of students that attend, and that's not including charter schools or private schools in my community, that 400 number is a bit small. So I don't know if you had any insight on.
No, absolutely, Commissioner. It is by all means not the only place. So we know that many of our pediatric clinics, our clinical providers are doing this age group. We know that they are coming as well to many of our sites, and we know that it is so our school partnership is more a supplement for out of convenience. Some parents might not be able to take their children, and there's just, and again, we are working with schools that are willing, that they say we want to do this. They are providing most of those, and these are the numbers that the school provide. But as you suspected, we know that there are others, and I think we will start seeing those numbers as we are starting to plot that age group or do the age group.
Yeah, and I do read, I was reading an article yesterday about the percentages that the state of Michigan, how we're at, and it did seem that the under 16 age group was at a pretty high percentage already, even compared to the rest of us. So, that is encouraging. I did have one last question. So I know that demand for the vaccine has slowed a bit. What will happen if, let's just theoretically, no one else wants to get the vaccine as of today, and we're close up our clinics. This is the percentage where we're at. What would happen with COVID? Will it continue on? Will it mutate? Will it affect those who are already vaccinated if we never get to that 70%?
Right. So before I answer that question, I just wanted to show you again, this is the number that you are looking at for 12 and 15 in Wayne County. So the number is 87,000, and we just started a week ago. So this
Right.
number is very encouraging, almost 15%. So yes, although we are, these numbers aren't only from the schools that we're visiting. This is from
And then
everybody
even
that's vaccinated.
the 16 to 19-year-olds
Yes.
it's a good
So
percentage.
so to your second question, hopefully we will not encounter that at all. And I think we are doing very well but it's going to be slower to get to that 70%. Of course, hypothetically speaking, if we do not get to that herd immunity, that means we will have that period where we coexist with the infection. There are those that are protected, but there will be still active transmission. I don't think we will go into higher spikes because there is some level of protection. But yes, the longer that virus is lingering on, the more potential it can have to reconstruct its DNA, to mutate, to find other ways to survive. And again, the mitigation that have been working very well in terms of protecting and stopping the spread, in addition to the vaccine, are our best policies, and this is what we keep pushing for.
Okay, great. Thank you. That's all I had. Thank you, Madam Chair. Oh, you're on mute, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Colleen.
Thank you, Madam Chair. Good morning, good afternoon, Dr. Hamami.
Afternoon, sir.
No questions for you today, Doc. But I do want to comment, your stewardship and your leadership here. I just want to thank you for that in heading up the county response to this. I know it's been a yeoman's job, but also the last month and a half of data that you brought to us, to me, says one thing and one thing only: vaccinations work. So thank you so much for the work you've done, Dr. Hamami, to this point, and the work yet to go. Thank you, Madam Chair.
Thank you, Commissioner Colleen. And thank you, Dr. Hamami, for all the work you are doing and for your report.
Thank you very much. My pleasure. And of course, it's the team of our Wayne County Public Health and all the support that we're getting across the board. We appreciate that.
All right, thank you again. All right, next item, Madam Clerk.
Item 2, communication from Carol Osterberry, Director, Health, Human and Veteran Services Department, Public Health Division, forwarding notification of an emergency procurement report for a contract with an option to renew with Garden City.
All right, this is receive and file. I believe the next 2 items, actually the next 10 items are receive and file. We'll take these together and then we'll have discussion on each of them. Is there a motion?
Move to receive and file, Anderson.
I'm sorry, commissioners, could I interject just real quick?
Sure.
Sure.
Chris Albrecht, policy analyst, commission staff. Items 2 through 5 are emergency procurement reports for receive and file, and then items 6 through 9 are first contact program contract amendments, and those are items that require commission approval.
Okay, so then we'll do 2 through 5. And Commissioner Anderson moved. Do we have support for 2 through 5? We will receive and file.
I'll support.
Thank you.
Bob.
Thank you. All right, item number 2, we will move to for discussion. Is there any questions from commissioners?
Yes, Madam Chair.
Yes, go right ahead, Commissioner Dodd.
Thank you. I noticed that Commission Council has a lot of concerns on these emergency procurement items. I just wanted to check in with her to see if she wanted to ask any of those or bring up any of those concerns in this committee. Is she here? I didn't even look.
Through the chair, I am here. Good afternoon, everyone. So Commissioner, you are correct. We do have an analysis for these particular emergency procurements. Some of the issues are issues that we've discussed and that you've seen in the past with regards to other emergency procurements. As far as there not being started end dates and terms for some of them, with regards to missing documentation. Again, many of the issues that we have discussed in the past with regards to other procurements, there are some unique ones I want to point out. So with regards to the one for Garden City, you'll notice that most of the concern was related to the term and the fact that they enter into an emergency procurement for 3 years, which again is something that we have discussed in the past regarding what's the appropriate time period for an emergency procurement, and whether or not 3 years is appropriate under the ordinance is something for this body to determine. So we did note that that particular item was 3 years. With regards to item number 4, there were some suggestion by the administration that this particular item did not require commission approval, that the procurement orders was not applicable to it. So as you'll see in the Forgotten Harvest analysis, which is item number 4, there was a lot of back and forth between my office and Corporation Counsel and the department with regards to this item. They again contended that this item does not fall under procurement ordinance and suggested that it does not require commission approval. But as again indicated in the analysis, the fact that it is a subrecipient agreement does not exempt it from the requirements of the procurement ordinance or the requirements for approval of this body. All that means when it's a subrecipient agreement, what that means is that this county has received some type of grant funding. So maybe there was a grant from HUD that the county received and the county was supposed to provide home counseling. Or maybe there was an EPA grant that the county received and the county was supposed to clean up the rouge. So under those grants, the county would enter into a contract with third parties. So the county would enter into a contract with the third party to provide home counseling services, or the county would enter into a contract with another vendor to clean up the rouge, whether it's services or construction. The contract between the county and the vendor are subject to the procurement ordinance because it's still procuring goods, services, or construction. The fact that it is grant funded has nothing to do with the requirements of the procurement ordinance or whether or not it requires your approval. So again, as you'll see in that analysis, which is item 4, there was a lot of back and forth and that issue has not been fully resolved with the administration with regards to whether or not these agreements actually require commission approval. Historically, this body has approved them, and I don't see any legal reason why you should not continue to do so.
Thank you. I do want to tell everyone that we are planning a discussion on the emergency procurement ordinance in the Committee on Government Operations during our next meeting. I can't remember the date off the top of my head, but we will be discussing these and these concerns that just keep occurring. So that's all I had, Madam Chair. Thank you.
Thank you, Commissioner Dobb, for bringing that up again. We have brought the issue of these emergency procurements and the whole process up again and again and again. And so I was hoping that the chair would have some type of consensus or meeting about these emergency procurements. And so I believe that you're indicating that you have talked to the chair, and this is where that discussion has or will be in your committee. Is that correct?
Yes, I am the chair of the Committee on Government.
No, I meant the chair of the commission
the chair,
to
yes.
address the
Chair
overall.
Bell.
Yes.
Mm-hmm.
Okay, so great.
Also, through the chair, this is Joel Slazak. Sorry to interrupt. June 9th will be the date, and we do have a commitment from Aaron Wagner to attend that meeting.
Great. Okay, great.
Madam Chair,
Yes, Commissioner Marecki.
thank you. And thank you, Commissioner Dobb, for putting this in your committee. I'm going to write this down because I really want to be in this discussion. Felicia, items 3 and 4, are they any different than all the other emergency procurement items that have been coming since the CARES Act money was allotted to us? I mean, your concerns, are they different, any different than all the other concerns you've had in the past about these emergency procurements?
So with regards to item, it's 3 and 4, but specifically item number 4, yes, there is the one concern that is unique that has just come up that I've been discussing with the department, and that is the concern related to whether or not, again, subrecipient agreements, which just means that the county's passing along grant funding, whether or not those agreements require commission approval and whether or not those type of agreements are subject to the procurement ordinance. Again, the fact that the county is using grant funds to pay these vendors does not exempt the vendors or the contracts from commission approval or from the procurement ordinance. That's just a funding source, but the actual contract is actually for a good or a service or construction, and that is under the what the procurement ordinance governs. So those items would require to be compliant with the procurement ordinance. And again, historically, these type of agreements have, to our knowledge, complied with the procurement ordinance and have been submitted to this body for approval. So when we received the request and the concerns regarding this from the department, we weren't clear as to why one, commission approval was not required as suggested, and why it was suggested that these items were not subject to the procurement ordinance. Again, that is a new issue that has arisen that's different from the other emergency procurements that we've discussed.
Okay, so hopefully, I mean, I'm not Commissioner Dobb, but I'm hoping that we can touch on this type thing too, because the monies are just going to be continuing to flow in to counties and everything else. So we need to get a handle on what's going on with this. So we don't, so we can just move on, and something has to be done that we're not always discussing this. So yeah, thank you for that. And
I don't know.
Oh, go ahead.
If there is any feedback from the administration, anyone to talk to this issue at all.
Hi, Cheryl Jordan, Deputy Corporation Counsel. So
go right ahead. Thank you.
Yeah, so specifically for these two, Gleaners and Forgotten Harvest, at the time that these were prepared and the services provided and the funds sent over, this was when the CARES Act funds under the federal regulations had to be spent by December 30th or December 31st of 2020. And so the department, classified it as a subrecipient agreement, and also that we had to execute the agreement in an emergency fashion. We thought we were going to lose the funds if we didn't get them. Of course, as we all know, it was like on New Year's Eve, the federal government extended that date. So had we known that the funds were going to be allowed to be spent after, I feel like this might not have been an emergency. But there is another issue that went back and forth that I assume is in the analysis from Commission Counsel regarding the difference between a subrecipient agreement and a professional services agreement, and whether or not the procurement ordinance applies equally to those two types of agreements. It was never suggested that the Commission didn't have to approve subrecipient agreements. In general, they do get approved by Commission. It was just in this instance, they were executed as an emergency, and that's sort of where the confusion and the ambiguity specific instance. So, I've written down the date of June 9th, so I'll be happy to attend so we can be prepared to fully flesh out these issues and make sure that, everyone's on the same page going forward.
Great. Thank you for that clarification on your side of it. All right, are there any other questions? It looks like we've basically covered 2, 3, and 4. Unless there's any other questions on those from commissioners. Doesn't appear to be. Number 5, are there any questions? All right, if they are none, we will vote on items 2 through 5. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. Items 6 through 9, I believe, are first contact grants. So we will take those together. Is there a motion? 6 through 9?
Colleen makes the motion to approve items 6 through 9.
Is there support?
Support.
All right, it's been moved and supported. We will now discuss each item. Number 6. Are there any questions from commissioners? Number 7. Any questions?
Madam Chair?
Yes, Commissioner, Vice Chair Colleen.
Yeah, thank you very much, Madam Chair. I just wanted to comment here. On our addenda today is a full and complete report on all of these programs that we have for youth. And so the effectiveness of the first contact program that we're talking about today is actually in that report. It's on, it's a little bit of a horse before the cart here, but you can go into that report and see the effectiveness of these programs. Thank you, Madam Chair.
Thank you, Commissioner Colleen. All right, number 7. Any questions? And number 8. Any questions? None. Discussion? Number 9. All right, any discussion? Questions? All right, it's been moved, supported, and we will vote. We'll do a roll call vote for these items, 6 through 9.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick,
Yes. Are there any opposed to this? And any abstentions? All right, motion passed. Next item.
1 second while I pull up the agenda. Item 10, communication from Shanetta Coleman, Director, Department of Health, Human and Veteran Services, Juvenile and Youth Services Division, forwarding the outcome data for Juvenile and Youth Services Program for fiscal year 2019 through 2020.
All right, Director Coleman. Are you here to speak on this?
Yes, ma'am. Good afternoon.
Good afternoon. Welcome.
Thank you. Shanetta Coleman, Division Director for Health Veterans and, I'm gonna say Health Veterans Community Wellness. for HHVS, Division of Juvenile and Youth Services. Thank you all so much. What I have that I can share with you, if I'm allowed to share my screen, is a very comprehensive report for all juvenile youth services activities that took place from October 1st of 2019 through September 30th of 2020. As Commissioner Colleen referenced, the first contact contracts and all of the providers who support our programs are also listed within that report. All of the outcomes are comprehensive in nature, so it is a compilation of our care management organizations, our Juvenile Assessment Center, who provides the assessments for all youth coming into our care, as well as the prevention services under our first contact programs and the youth assistance programs as well. I'll be more than happy to share. It is very a comprehensive report. I would, if you would like to draw your attention to a couple of different dashboards and screens that you can kind of do at a glance. And at your leisure, you feel free to read all of the details of the activities and things that occur in within the program overall, if that is the pleasure of this body.
Yes, if you can just go over a few of the major major provisions of your report and any analysis of the overall programs.
Absolutely. So if you want to follow along, I will just hit just a couple of the pages that have the data details in them, and I'll call those out by page number, starting with, if I can get this to work on my end here. Starting with page, first of all, let me say this for the new commissioners. This is just a map of the service area that is covered under the Child Care Fund for Wayne County, and where all of our care management organizations and others provide services. So going to page 3, this is our performance measure data. And this gives us a good snapshot. We do this year over year so we can monitor and adjust program services based on how well we are performing or where we see that there needs to be any types of modifications to program services. It will show you where the baselines were when we first started Wayne County in 1999. As you would see, some of these things, programs were not in place, and you'll see that denoted as not collected at that time. But of particular interest to you right now will be what has happened over the last 3 years. One of the things that we are really proud of is that we continue to maintain low recidivism rates. When you look at it from a national perspective, we did see for 2020, our recidivism rates were as low as 8.7%, which I think is awesome. We had a little bit of a hiccup last year where we had a 86%, which is still under and doing well, but we like to maintain that number at 11% or less if we can. This also gives you a good picture in terms of when you talk about the CMOs and probation level youth who may have gone from a residential placement down to a community-based placement, where they then will go into probation level 1. You'll see that that the outcomes have consistently been above the 80 percentile. Last year, 2020, we were at 89.3%. That is, that's also something we're extremely proud of. And even going back the last 3 years, it always has been well above the mid 80s. I am going to, just for give you an idea of how many kids, new kids were acting participants in our diversion program toward the bottom of this chart. Last year, we had 325 new diversion cases. We also had new first contact cases and YAP cases. We served over 1,500 youth in those YAP programs, and then 1,073 in the first contact programs in which you guys have just approved the extensions for. I'm going to now take you down to page 7 of the report, which gives us another set of data. And page 7, this is our major dashboard where you'll see a number of our key performance indicators. It gives you, again, a year-over-year perspective in terms of how we're doing on a larger scale. And so you can see all the measures. We go back here for a 4-year period of time. The color coding is an indication for us in terms of where we feel that we could, we may be off, or there needs to be an improvement if we're on task or if we're marginal. So any place that you see green, that is a good thing. If you see blue, that means that we might want to monitor that a little closer. And then obviously red, we consider that to be unfavorable. I want to go up to the unfavorable in the center of the page at YAP and first contacts. It's not unfavorable because we had bad outcomes. We would like to see more kids participating in the program. If you go back a few years ago, we had as many as 6,700 kids in that program. And the year prior, it dropped down to 1,600. So we like to have that number at least over 2,000 if possible. We equate these programs and what we consider first in programs are being the reason why we do so well when kids, if, keeping kids out of the formal adjudicated system. And if they happen to end up there, they usually fare much better in terms of outcomes. We've had some kids that were placed for technical violations, and so they were escalated. A technical violation could mean that they were on a tether or they were not complying with the order of the court, not that they necessarily got into any additional or new charges, but the CMOs may ask for, or the court might find it necessary to escalate that youth into a higher level of care. I want to take you down now to page 22. Just to give another glance, a larger picture of the map, which has some zip codes in it. That way you would know where your service areas are. This is our map. We cover everything in this area down here. And so, sorry, that's what happens when you work from home. I'm sorry, my house phone is ringing. That is the map of the county. I'm going to take us now down to page 27. And on page 27, this is going to start taking us into the specific details in our first contact. It also gives you a list of who our providers are and the type of services that they deliver. First contact, again, the data, we had 1,073 kids that participated last year. And as you can see, in 2018, we had over 2,000 just in first contacts alone, but the numbers in terms of outcomes continue to be above the 80 percentile. So we are very satisfied with the service delivery in these programs. Same would be true for, this is just some pie charts of that data. But the same would be true if you take a look down further at our YAP services. And we had in 2020, 800 youth participating in the program. And again, successful outcomes, meaning that they obtained their goals, were above the 80 percentile. And you would see that across our program services where the kids are doing quite well, above 80% success rate. Now, I do want to say, when you look at our right track, which is our diversion program, sometimes these kids are in the program for a shorter period of time. That sometimes is a hit or miss, just depending on the nature of the youth and their willingness to participate. If they don't participate in the program, if they don't meet the required face-to-face contacts, then that obviously has to be reported up to the prosecutor's office, and the prosecutor at that time could decide if they want to move forward with that kid and formally adjudicating them. So sometimes those numbers are lower than what we would like to see in some of our prevention programs. And as you can see, it's demonstrated there that that number was probably one of the lowest that we have. Then one of the other things that I always like to bring to the attention of funders and others is when we talk about the impact of these services and the cost of services, it is always better for a multitude of reasons to keep kids in the community. This chart will show you what it costs for kids to be serviced in the community, which is what you'll see, whether it be in a prevention program like First Contact. We usually try to keep them 3 to 6 months. Average cost per participant is about $3,200. The youth assistance program, if they're under Right Track, they're in the program for 6 months, and that's about $1,400. So let me take you to kids who have been adjudicated. You will see that under court ordered probation level 1 and court ordered probation level 2. Probation order 1 means that that kid is being served in the home. They're generally in the program for about 6 months. It's $2,300 per youth. Sounds like a lot, but it's better than having that kid adjudicated into a probation level 2 status. They're in that program for about 11 months. Sometimes it could go longer, but on average it's 11 months. It is $98,000 per participant. So it is always better to invest and engage in kids early on so that we can spend less money and still give them the adequate care that they need in order for them to be successful. And these other things, just again, the array of services that you would see across the board in our care management organizations. So you can feel free to read these at your leisure. But that pretty much is the gist of the program. We'll let you know how many kids that we generally have in the program. For instance, our care management organizations served over 1,400 adjudicated youth. And then obviously that's broken down depending on the zip code that the kid lives in or the family is in. And so there is that is how assignment to care management organizations occur. The purpose of doing that is to make sure that the services are delivered in the community or in a setting that is best suited for that youth, to support them and make sure that they are successful in the program. If they have to go across several zip codes, sometimes that could be a barrier to meeting with their case manager. You'll also find in here the percentage of serious felonies and some of the misdemeanors and status offenses that we encounter, then just basic caseload trends. So that in a nutshell is the annual report. I tried to get through it as quickly as possible, but it is a lot of information here. Feel free to read that at your leisure. And unless there's some other questions or anything that I could point to in this report, I am open for any questions.
Thank you for that thorough report. Very informative. As far as reaching out during COVID, have you seen that the numbers have fallen because of that? And what are we doing to kind of make up for that, if anything? Do you know?
Yeah, sure. We did. We saw a decline because of COVID. A couple of things. The court has, now we're playing catch up. So, we went to virtual court. That was one way that we started seeing an increase in the amount of activity. As it relates to referrals, a lot of the schools were closed where we would get referrals, churches where we would get referrals, some community centers where some of the referrals will come for First Contact and those front end program services. They just were not in service. And so we get a lot of referrals from the schools that while they have to be authorized by the court as being someone who's at risk and can benefit from the service delivery, those types of engagements were not occurring for new referrals. As it relates to families and young folks who were involved in the program prior to the pandemic, and then while the pandemic was at its highest peak, we could not do face-to-face. So we had to get creative in terms of making sure that we stayed engaged with those families. And so we did things like, we would go knock on the door, stand on the porch and talk on the phone and use FaceTime and Zooms and that sort of things to stay in touch, but we weren't necessarily getting new referrals. So we did see a decline in the number of participants in those particular programs, as the court has also saw a decline in the number of preliminary hearings that they've been able to hold because they're doing a lot of them virtually.
Thank you. Commissioner Colleen.
Hey, first I vote unmute. Thank you, Madam Chair. Good afternoon, Dr. Coleman.
Good afternoon.
Yeah, welcome. Ever since the county took this over from the state, or should I say the state of Michigan kicked it down to the county in the waning days of the Engler administration, this has been a tremendous success story for Wayne County. I'm glad you have some of the historical numbers in here going back to those ugly days. And so to you and to your predecessors and Children and Family Services, when we called it that, just a tremendous job. I went on the website last night after the agenda came out, the county website, and I went again this morning. When are you going to post this to the Juvenile Youth Services webpage, the annual report? I'll take note that one has not been posted for 5 years, and I've asked about that before. This is a tremendous story for the county to tell its citizens, tremendous success stories. So when do you anticipate that's going to go up on the website so everybody in the county can see it and review it at some point?
So I will commit to, as soon as it goes before the full board, we will move it on to the communications department to support and assist with getting that posted.
Thank you. Excellent. And great job as usual. Thank you, Madam.
Thank you so much, sir.
Thank you, Commissioner Colleen, and thank you again, Director Dr. Coleman, for that thorough report.
You're welcome. Thank you.
All right. So we do not have a motion to approve. Anyone?
Move to receive and file.
Support.
All right, it's been moved and supported. All those in favor, let's do a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right, are there any oppositions? Anyone in opposition? Any abstentions? All right, motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
If you can unmute everyone. If there are any public comments, you can do so right now. Anyone that has a comment? All right, are there any emails, Madam Clerk?
No, we have not received any emails.
All right, if there are none, we'll move to the next item.
Adjournment.
Move to adjourn.
Support.
All right, it's been moved and supported. Thank you all. We will adjourn. Have a good day.
You too, Madam Chair. Thank you.